Let's see, I'm here today to talk about Medicare health insurance. My name is Peggy Michael. I'm a licensed and insured broker. I find myself in 28 states across the nation, and our home office is in Denver. So if you need anything at all, don't hesitate to reach out. Here's my information on the first screen. Whoops. Oh, Christy, I think your screen sharing has stopped. Can you bring me back, Christy? Are we
Oh,
there?
I stopped screen sharing so you could share your
Yeah.
presentation. Do you want me to share it for you?
Sure. Yeah.
Okay. Sorry about that.
Yeah. Oh, that's okay. That's okay. I can do it, but yeah, that'd be great.
All right, let's try this again. Okay. All right, are we going? Is it sharing?
Oh, there.
Is it going? Okay.
It came back to me. Thank you.
Oh, we did? Okay,
It
good.
came back to me. So I think I'm in charge now, right?
Okay, yes, you should
Oh,
be.
wait.
You should be able to click
Okay.
through. Let me know if that's working.
Um, can you click through? Is it on you? Sorry, guys.
No, that's okay. You're fine.
There we go.
There we
Did
go.
you do that or did
I
I?
did.
Oh, thank you.
You're so welcome.
We'll get this, guys.
We will.
Yeah. Anyway, at Integrity Health Advisors, we're a team of about, I think we're at like 65 brokers who are across, find themselves across the nation. So I do work with a very strong team. We work together, we share information. We are independent advisors, and I am one of the founding members of Integrity Health Advisors. So we share information, do all of our contracting together, and make sure we're all fully compliant. At the end of the day, always know that we work for you, for the member. Our desire is to make sure that you're on the right plan for you. You do have choices and options, and that's what we're going to go over today so that you know kind of what your choices and options are. Working with me, there's no cost to you at all whatsoever. I do receive a commission from whoever you do select as your carrier, and Medicare highly regulates that and dictates exactly how we are compensated. So just keep that in mind. You don't have to pay for any of that. As I mentioned already, our home offices are in Denver, but we're across the nation too. So thanks. Questions we're going to answer today. What is Medicare? Who is eligible for Medicare and when you're eligible? What options you have that are available to you? You do have choices. How do you enroll in Medicare and choose the correct options for you and your needs? And what resources are available to you? First of all, who is eligible for Medicare? Typically, so let me start with what is Medicare? Medicare is our federally funded health plan. It came out in 1965, and for all intents and purposes, really has had very few changes since. You are eligible for Medicare when you are 65. If you have paid into the system for at least 40 quarters, which is 10 years. So if you've worked 10 out of 65 years in your life, even if it was from age 16 to 26 or something like that, you are still eligible for funded Medicare. and you need to be a US citizen and resident for a minimum of 5 years. Another way you're eligible for Medicare is if you are disabled and have been receiving Social Security Disability, that's SSDI, for 24 or more months. And that's at any age. So, yeah. Enrolling in Medicare, B, C, or D. When can I enroll? You can enroll in Medicare. We're talking about when, again, if you're on SSDI, it will be after 24 months. If you're turning 65 and you're aging into Medicare, you can start your enrollment process 3 months prior to your month of birth, your month of birth, and 3 months after. It becomes effective, though, on the first of that birth month. Okay. Also, if you defer your Medicare, you have 2 months after you leave your current health insurance coverage, and that's typically your employer-sponsored health coverage. It needs to be credible coverage for Medicare to enroll. So employer-sponsored health plans are considered credible coverage. What's not considered credible coverage is if you're on COBRA, or if you're buying your coverage through the Affordable Care Act, that's your state-sponsored individual health plan. What if you're late? You will not be able to enroll in Medicare until January, February, or March of the following year, and you may have penalties assessed if you didn't follow these rules. What are the parts of Medicare? Medicare, I always call it the alphabet soup. Lots of alphabet soup in this presentation. So Medicare Part A is our hospitalization. Medicare Part B is pretty much anything outside of inpatient hospitalization. So it's your doctor's appointments. It includes equipments like MRIs, CAT scans, durable medical equipment like crutches, things like that. It also includes Part D of Medicare. Medicare requires that we all have a drug plan, whether we take drugs or not. And then private insurance manages your Part C of Medicare and any supplemental. What are your options with Medicare? You must have original Medicare. That's that red, white, and blue card that you see on the screen. You must have Parts A and Part B of Medicare. And then you get additional coverage. You can get that additional coverage through option 1 here, Medicare supplement insurance. Again, that's more alphabet soup. And you must have, these are the standalone a la carte ways of doing things, the supplement and the Part D of Medicare. Or you can choose to go with a Medicare Advantage plan. That is considered Part C of Medicare. I like to call Part C the cup of Medicare, because if you turn your C sideways, it's a cup, and everything you need is all in one. They are offered by private insurance companies who are delegated by Medicare to manage all of your needs. When can you enroll in Medicare Part A? After you turn age 64 and 9 months. So that's that 3 months prior to your month of birth. Enrollment is automatic if you already have Social Security. If you're drawing Social Security, you'll automatically get that card. There will be no penalties assessed if you're late. Or if you're not drawing Social Security, then you enroll at www.ssa.gov. It's the most important thing I'm going to say today. Always make sure you're going through the actual .gov site. I'm going to get on a little bit of a soapbox and make sure don't go to anything.com or .org. Those are typically sales sites. So make sure you're on .gov. Thank you. What does Medicare Part A provide? It's our hospital visits. It's your inpatient hospital or mental health care. It's also skilled nursing facility services, hospice care, and blood transfusions are covered under Part A of Medicare. What is the cost for Medicare Part A? Most of us don't have a premium for Part A that is fully funded typically through our lifetime of work. So if you've worked just 40 quarters in the system, you have paid in. Our favorite friend, FICA, who takes all our money every month, they are using that towards your Part A that you've paid into the system, into the Social Security system for our lifetime of work. If you have only Medicare Part A, there is a deductible on that. It is $1,676 when you're admitted to a hospital. That is for multiple hospital stays and means for that deductible, for that $1,676. And there is no international coverage under strictly Part A. Part B. Part B of Medicare is not fully funded through our lifetime of work. The Medicare actuaries get together and they determine what a standard Part B would cost. And we are funded 3/4 of our Part B, and we contribute typically 1/4 of that cost. It pays. Medicare was never intended to be free. I like to point that out. It was never, ever, ever intended to be free. In 1965, it was developed as a small Part B premium and then as an 80/20 plan. So Medicare Part B would pay 80% of your physician's services, your outpatient hospital services, your ambulance, any mental health, any labs, durable medical equipment, as I mentioned, like oxygen, wheelchairs, crutches, that boot if you broke your ankle, and then preventative care. Some preventative care is covered under Part B on that 80%. Things you should know about Part B. Part B of Medicare in 1965, they didn't add a maximum out of pocket. So you will pay those 20% throughout the year with no stopping. The premium is based on your income. The standard Part B for 2025 is $185 per month. If you make more than a standard rate, and for 2025, I will tell you, if you file your taxes individually, it's $106,000 unless you pay $185, and it's double that if you file joint taxes. So $212 joint taxes, and Medicare always does a 2-year look back. So they're going to see what your income was in 2023. If it was less individually than 106 or joint 212, then you will pay the standard rate that most people pay of 185. If you make more, there is a fee schedule associated with that, and I'm happy to share that with you. Just reach out to me. You can also find that on medicare.gov, G-O-V, always .gov. So your co-insurance requirements need to be met after the deductible. And for 2025, the Part D deductible is $257 a year. And then it starts paying claims at 80%, and you have a 20% coinsurance. You are penalized if you are late to enroll, unless, remember I said earlier, you have credible health coverage through work. In this case, you can defer your Part B And when you're ready to retire or jump onto Medicare, you get, there's some forms that I have for you, and I'm happy to share them whenever you're ready to retire, and your HR department will fill those out. So no penalty will be assessed for that. Medicare Part D. Medicare requires that we all have a prescription drug plan, whether we take prescriptions or not. This is a government program that is managed by private health insurance companies. So Medicare doesn't actually provide the Part D, but they do create the drug payment stages that we'll go through here in a minute. You always must continue to pay your Part B premium. That Part B never, ever, ever goes away. Medicare sets what that is, and you must pay it. I always say it's kind of like taxes. They kind of tell you what you owe, and you pay it to get your Medicare. That's your contribution. Formularies can vary by company. So you always want to make sure when you're working with a broker or someone like me that you share if you're comfortable sharing what your prescription drugs are, and that will help us find the best prescription drug plan for your particular needs. Benefits and costs vary from company to company, and you will be penalized if you do not have a prescription drug plan for 63 or more days. Understanding the stages of Medicare Part D prescription drug plans. And this is for 2025. 2026 is going to be slightly different. I haven't updated the slides yet because it's not final on what we're going to have for 2026. There are going to be slight increases for next year, though I am aware. The first thing you have to do is satisfy the annual deductible on your prescriptions. Medicare has set that at $590 for 2025. After you've met the deductible, you'll pay at a maximum, excuse me, after you've met your deductible, you'll pay at a maximum 25% of your prescription drug costs. This phase will last until you reach $2,000, and then you'll reach the catastrophic coverage stage. Once you hit that $2,000 mark, you won't pay for any more of your prescriptions the rest of the year. So let me throw out a simple example. Many of the carriers that offer your prescription drug plans, they don't charge your deductible on the generics. So that's really nice. So if you're on a basic statin or a blood pressure or a thyroid type of medicine, the generics, the tier 1 or tier 2 generics, they don't even apply that $590 deductible to it. So those are typically very low in cost. Where you will see the deductible applied is on high-end brand name or specialty drugs. That's when you'll pay either a copay or 25% of the cost of the drug. Please keep in mind, in the catastrophic coverage zone, once you've reached $2,000, the rest of your prescriptions are covered at 100% for the rest of the year. So an extreme example would be someone on like an oral chemotherapy, where that's about $250,000. You would only pay $2,000, and the rest of the year that's zero. So it really is pretty amazing that we're able to cap it at that. Thanks, Christy. Here's Part C of Medicare. I told you earlier, I love to call this the cup of Medicare. This is offered by private insurance companies, and it really is very similar to what you have now with your employer-sponsored health plan. As a matter of fact, Advantage plans were modeled after employer-sponsored health plans. And what they do is they combine Medicare Part A, Medicare Part B. Usually it includes your Part D, your drug plan. Premiums vary by carrier between $0 and $50. There are some really high-end ones that cost $100, but very, very low premiums. Remember, I want to say it again, I don't have a little bullet for it, but you must always pay your Part B And then you'll get your Medicare Advantage plan. And like I say, they're very low monthly plan premiums. Most popular ones are actually zero. They include your A, your B, your D, um, and the premiums can change from year to year, but the most popular ones don't cost anything. So those are great. But you always have to pay your Part B. Eligibility for a Medicare Advantage plan, you must have Part A and Part B of Medicare. You must live, and they vary by service area. So you must live in the service area that you're getting that plan. Have a valid election period, like you're new to Medicare, or it's the annual enrollment period, or maybe you've moved and you're new to that area. So you have a valid election period to go ahead and enroll in what's new in that area. Special needs plans are also considered Medicare Advantage plans. That can be for someone who has both Medicare and Medicaid. Medicaid is financial aid offered by the state and is considered dual because you have Medicare and Medicare, two sponsored plans through Medicare, your health care, or Medicaid, your financial aid through the state. Another way you can have a special needs plan is if you have a chronic care condition that's usually uncontrolled diabetes or specific heart issues. Eligibility for a supplement. Remember when, if we step backwards to the beginning, you saw that Medicare supplement, that's the a la carte way of covering your Medicare, those deductibles and all of those 20%. Remember, that goes away when you get either a supplement or an Advantage plan. That's filling the holes of those deductibles and 20%. So in order to be eligible for a supplement, the a la carte, you must be enrolled in Medicare Part A and Part B. Remember, you must have both parts of original Medicare and always pay that Part B. You must be a resident of the state in which you are applying for coverage. And if you do not have a guarantee issue or an open enrollment, then you must go through underwriting by the carrier. Your enrollment period for Medicare supplements to get that guarantee issue so you don't have to go through underwriting. That happens when you turn 65. So you have that 6-month window, your birth month and your 5 months after. So remember, you enroll in A and B. You typically do that 3 months prior to your month of birth. You get that red, white, and blue card when that arrives, hopefully in plenty of time. Your birthday month, you then have 5 following months to choose a supplement if that's how you'd like to go. What happens if you're late enrolling? You can still enroll, and you can always enroll in a Medicare supplement, but you will not have guarantee issue. You'll have to go through Medicare underwriting. And if you go through underwriting and you have a chronic care condition or something like that, you might be charged a higher level for that supplement. Okay, here's the alphabet soup, more of the alphabet soup. Medicare supplements are also called Medigap plans. So those terms are used interchangeably. So, so you know that a supplement is the same thing as a Medigap plan. Medicare supplements are always provided by by private insurance companies, but every company must provide a standardized plan, and they're regulated by federal and state laws. So therefore, Plan A, B, C, D, F, G, K, L, M, N, and high deductible Plan F and high deductible Plan G, they are regulated and they are the same regardless of carrier. Benefits can, though, vary slightly state to state. Carriers can change. So for example, some plans maybe carry silver sneakers or something like that. and some do not. But that's an ancillary addition. The base plan of the alphabet soup are the same. Here's a little overview of what the supplements cover. And I'm going to pinpoint two of them that are the most popular and that are kind of worth their salt, so to speak, in my opinion. Plan G, I like to call it Plan Great because it really is your highest level of payment, but it also carries, of course, the highest level of premium. With Plan G, Medicare pays their part, and then Plan G comes in and pays what Medicare does not, with the exception of the Part B deductible, which for this year was only $257. The other plan that I just really, really think is worth it is Plan N. And I call it Plan Not So Bad. So with Plan N, all you have to contribute is the $257 Part B deductible like you did in G. But then when you receive services, you'll have a $20 copay. And if you go to the emergency room, it's a $50 copay. And it's a possibility that you would have a 15% excess charge if approved by Medicare by that provider. So I call it Plan Not So Bad. The premiums aren't quite as high as Plan G. Little lower premiums, and then you do have those small deductibles when you receive services. Facts about Medicare supplements. If Medicare, remember, Medicare is the first level of adjudication. So if Medicare doesn't pay that bill, if it's not a Medicare approved service, then your supplement won't pay. Your supplement's only job is to pay what Medicare tells them to pay. So remember, G is G, N is N. It doesn't matter who the carrier is. So by carrier, I mean United Healthcare, Humana, Anthem, Aetna, Mutual of Omaha, Cigna, Aetna. Did I say? Anyway, you get it. That's the carrier who insures you for your supplement. And you are fully covered wherever you go in the United States. And it's guaranteed renewable as long as you keep paying those plan premiums. And here I let you know that you get in at one rate, but those premiums do go up annually. So to bring it all together, Medicare itself is your red, white, and blue card. That's A and B. You go to ssa.gov to enroll 3 months prior to your month of birth, or upon retirement and losing employer-sponsored health coverage, or you're just ready to jump from your employer-sponsored health coverage to your Medicare plan. You typically do that during the annual enrollment period with your employer and with Medicare, which is October 15th through December 7th of every year. To cover all of those deductibles and those 20% to kind of fill in those gaps, you can go one of two directions. You can either go the a la carte way and get a supplement and a standalone prescription drug plan. Those carry monthly plan premiums. Or you can go with the Medicare Advantage plan, which I call the cup, and you do all in one. It combines your Medicare Part A and B. It typically does add additional benefits like dental, vision, and hearing, which is not part of original Medicare. And most of your Medicare Advantage plans, the all-in-one, cover your prescription drugs, and they carry either no or a very low monthly plan premium. Again, my name is Peggy Michael. I am a licensed sales agent with Integrity Health Advisors. I've been at this since, I think I said earlier, since 1988. So for over 30 years, I've been doing this. So if you have any questions, I invite you to reach out for anything. Don't hesitate to give me a call if you're just doing some project planning and not retiring for a couple of years, or if you're not turning 65 for a couple of years. I'm happy to just walk you through what that might look like.